Last week, a 67-year-old gentleman came into my clinic. He was limping, visibly uncomfortable, and he told me he hadn't had a good night's sleep in over a month. When I examined him, I found severe skin infections, painful rashes that had spread across his entire groin area, and a urinary tract infection that was dangerously close to reaching his kidneys. He looked at me and said, "Doc, I thought this was just part of getting old. I didn't know it was serious." And that's when I had to tell him the truth. None of this was because of his age. It was 100% preventable. The cause, he hadn't properly maintained his pubic hair in over a year. And now, what should have been a simple grooming habit had turned into multiple infections that required aggressive treatment. I'm Dr. Beendra, and if you're over 60, this video might be the most important health information you hear this year, because I'm going to show you exactly how poor pubic hair hygiene leads to 5 serious diseases and the simple steps to prevent them all. Here's why this matters more as you age. Your immune system isn't as strong. Your skin becomes thinner and more sensitive. Mobility issues might make grooming harder. And medications can affect your body's natural defenses. So let's dive into the 5 diseases. Disease number 1, urinary tract infections. When pubic hair is unkempt and not properly cleaned, bacteria, especially E. coli, accumulate and thrive in that area. These bacteria are sitting right next to your urethral opening where urine comes out. Here's the dangerous progression. Stage 1, bladder infection. You'll feel burning when you urinate, need to go frequently, and feel like you can't fully empty your bladder. If ignored. Stage 2, kidney infection. The bacteria travel up to your kidneys. Now you have back pain, fever, nausea, and extreme weakness. And if still ignored, stage 3, sepsis, the infection enters your bloodstream. This is life-threatening and requires hospitalization. I had a 68-year-old patient who ignored UTI symptoms for just 2 weeks. By the time her daughter brought her in, the infection had reached her kidneys and she needed IV antibiotics in the hospital for 5 days. If you have burning urination, cloudy or bloody urine, or frequent urgency, see a doctor immediately. Disease number 2, severe fungal infections. The medical term is tinea curris. You might know it as jock itch. Seniors can also develop candida, a yeast infection that affects both men and women. Why seniors get this more easily? Your skin becomes thinner, drier, and less able to regulate moisture. Plus, if you have diabetes, you're creating a sugar-rich environment where fungus thrives. Here's the progression. Early stage, mild itching in the groin area. Moderate stage, red ring-shaped rashes appear. The itching becomes intense, especially at night. The skin starts to peel. Severe stage. The rash spreads down your thighs. The skin cracks and may ooze. Secondary bacterial infections develop. A 71-year-old man came to me with a fungal infection developing for 3 months. He was ashamed to tell anyone. By the time I saw him, the infection covered both inner thighs. He had painful open sores from scratching. He had a secondary staph infection. He couldn't walk without severe pain. Treatment took 6 weeks. If you have persistent itching in your groin area that lasts more than a few days, see a doctor. For seniors, fungal infections don't go away on their own. They get worse. Number 3, folliculitis and skin abscesses. Each pubic hair grows from a follicle. When that hair is unkempt and the area isn't properly cleaned, dead skin cells clog the follicles. Bacteria enter and multiply. The follicle becomes inflamed and infected. The dangerous progression. Stage 1, small red bumps appear. Stage 2, those bumps fill with pus and become painful. You might develop a fever. Stage 3, multiple infected follicles merge into a large, deep abscess that can't be treated with just antibiotics. A 69-year-old diabetic gentleman ignored what he thought was just a pimple in his groin area. Within a week, it had turned into an abscess the size of a lemon. He needed surgical drainage, a week of IV antibiotics, daily wound care for 3 weeks, and couldn't walk properly for a month. If you see A&E bump in your pubic area that's painful or getting bigger, see a doctor within 24 to 48 hours. Number 4, persistent odor and bacterial overgrowth. If you have a persistent, unpleasant odor coming from your groin area that doesn't go away after showering, it means you have significant bacterial overgrowth, and that's a medical problem. That smell isn't just embarrassing, it's a warning sign of bacterial colonization that can lead to infection. A 74-year-old woman stopped going to her bridge club, stopped attending church, stopped visiting her grandchildren, all because of odor she couldn't control. When she finally came to see me, it took just 2 weeks of proper hygiene guidance to solve the problem completely. She said, "I lost 6 months of my life because I was too ashamed to ask for help." There is zero shame in this. If you have persistent odor, get help before it turns into an actual infection. And number 5, increased risk of all infections. When you have dense, poorly maintained pubic hair, you're creating the perfect storm. Moisture gets trapped, dead skin accumulates, friction creates micro tears in your skin, and your immune system can't fight off what enters those tears. For seniors with diabetes, high blood sugar feeds bacteria, infections develop faster and spread quicker, healing takes 3 to 5 times longer, risk of serious complications is 4 times higher. A 66-year-old diabetic man developed a simple fungal infection from poor hygiene. Because of his diabetes, it didn't heal. It became infected with bacteria. That infection spread to his bloodstream. He ended up in the ICU with sepsis. He survived, but it required 10 days in the hospital, IV antibiotics, extensive wound care, and 3 months of recovery. His medical bills exceeded 80, all from poor pubic hygiene. For people over 60, especially those with diabetes, heart disease, or weakened immune systems, pubic hygiene isn't about aesthetics. It's about preventing serious medical emergencies. Now, here's the good news. You have control over this. Here are the practical solutions. Solution number 1, adapt your grooming routine. Trim your pubic hair every 2 to 3 weeks using a body hair trimmer with a safety guard. Sit down while doing it for better stability. If you have arthritis or limited mobility, ask your spouse or partner to help. It's healthcare, not embarrassing. You don't need to remove all the hair. Just keep it trimmed to about ½ inch. Solution number 2, daily hygiene. Every single day during your shower, gently wash the pubic area with mild, fragrance-free soap and lukewarm water. Get into the folds and creases. Rinse thoroughly, dry completely by patting with a clean towel. If bending is difficult, sit on a shower chair. Solution number 3, wear 100% cotton underwear only. Loose fitting, not tight. Change every single day. Change twice a day if you sweat or have incontinence issues. If you use adult diapers or pads, change them frequently and clean the area with each change. Solution number 4, if you have diabetes, keep your blood sugar controlled and check your groin area daily for any redness, bumps, or irritation. If you have limited mobility, don't be embarrassed to ask for help. Solution number 5, see a doctor within 24 hours. If you have burning or pain when urinating, blood in your urine, fever with groin discomfort, rapidly spreading rash, a bump that's getting bigger, severe itching, foul odor that doesn't go away, or any open sores. For seniors, what might be minor for a younger person can be serious for you. When in doubt, get checked out. Let's recap the 5 serious diseases. Urinary tract infections that can damage your kidneys. Severe fungal infections that can become debilitating. Folliculitis and abscesses that may require surgery. Bacterial overgrowth causing chronic odor and infection risk. And overall increased risk of serious complications. Think about that patient I mentioned at the beginning, the 67-year-old man who suffered for a month because he thought it was just part of getting old. It's not just part of getting old. You don't have to suffer. You don't have to be embarrassed. Here's what I want you to do today. If you're experiencing any of these symptoms, call your doctor today. If you're symptom-free, start implementing these hygiene practices immediately. If you need help, ask for IT. If you know a senior who might need this information, share this video with them. You've lived 60, 70, 80 plus years on this earth. You've earned the right to live those remaining years in comfort, health, and dignity. Don't let something as preventable as poor hygiene steal that from you. Like this video if it helped you. Subscribe for more senior health content. And comment, what other health topics do you want me to cover? Your health is not something to be embarrassed about. It's something to protect. I'm Dr. Beendra. Thank you for trusting me with this important conversation. Take care of yourself. You deserve it.